Hey everyone, welcome back. Today we're doing a deep dive that's going to be really relevant to one of our listeners in particular. We're going to be tackling high-risk pregnancy conditions.
Oh, good topic.
Yeah, we're looking at some excerpts from a nursing textbook,
Okay.
and it's a chapter all about, gestational conditions that can put both the mother and the baby at risk.
Right.
And I know that stuff can get pretty complex, so we're going to try to break it down to some key takeaways that you need to know.
Yeah, to really understand the significance of all of this, it's helpful to just zoom out to the bigger picture. Um, Hypertensive disorders, so issues with high blood pressure during pregnancy, are actually the most common medical complication
Really?
during pregnancy. Yeah, they impact, get this, 5 to 10% of pregnancies.
5 to 10%? Wow, that's a lot more common than I realized.
It is.
Okay, now I see why we're doing this, so let's break it down. What types of hypertension do we need to be aware of during pregnancy?
So, think of it this way. There are four main players: gestational hypertension, preeclampsia, and its more severe form, eclampsia, chronic hypertension, and then chronic hypertension with something called superimposed preeclampsia.
Okay, four main players. Got it.
Yeah.
Um, but I'm guessing it's not all the same, right?
Mm.
What makes each of these types unique, and why does it matter?
You're right. The differences really matter. Gestational hypertension, that's like the most straightforward one. It's basically high blood pressure that develops after 20 weeks of pregnancy. And it happens in a woman who didn't have high blood pressure before.
Gotcha.
What sets it apart from some of these other conditions is that it's not accompanied by protein in the urine, which can signal a more serious issue.
So high blood pressure after 20 weeks, but no protein in the urine. Okay, what about preeclampsia? You mentioned that one's a little more complex.
Yeah, preeclampsia is definitely a bit trickier. It also involves high blood pressure, developing after 20 weeks, but this time it comes with some extra baggage. Well, we're talking protein in the urine, headaches, and even vision changes. It can range from mild to severe,
Oh, wow.
and at its worst, it can develop into eclampsia,
Eclampsia.
which is where things get really serious.
Okay, so that sounds intense. What exactly happens during eclampsia?
So eclampsia is when those high blood pressure issues, they escalate to the point of actually causing seizures.
Seizures. Wow.
And these seizures can happen before, during, or even after labor. So it's definitely a situation that requires immediate medical attention.
So we've got gestational hypertension, preeclampsia, and eclampsia.
Yeah.
What about those last two? Chronic hypertension and chronic hypertension with, what was it again?
Superimposed preeclampsia.
Right, superimposed preeclampsia. I need some help unpacking that one.
Okay, so chronic hypertension simply means that the woman already had high blood pressure before she became pregnant, or it was diagnosed, before that 20-week mark.
Right.
And then the superimposed part, that means that in addition to their existing chronic hypertension, they actually develop preeclampsia during the pregnancy.
So it's like double the trouble.
Yeah, you could say that.
Before we dive deeper into preeclampsia, are there any red flags, anything that makes someone more likely to develop any of these hypertensive disorders during pregnancy?
Yeah, for sure. Some factors are unavoidable, like family history. If your mother or sister had preeclampsia, you're statistically more likely to develop it as well.
Wow.
Multifetal pregnancies, so like twins, triplets, that also increases the risk, as do certain demographic factors like being African American or being over 40 or under 19.
Interesting.
Yeah. And then, of course, there are some lifestyle factors too, like obesity, and then any pre-existing medical conditions like diabetes or autoimmune diseases.
Okay, so genetics, demographics, and just overall health.
Pretty much.
Okay, let's get back to preeclampsia. You mentioned that it can range from mild to severe. It's clearly a big concern. What is actually going on in the body? What causes preeclampsia? Why does it even develop?
So that's actually a question that researchers are still trying to fully unravel. Yeah, but we know that it's linked to problems with something called placental perfusion.
Placental perfusion,
Essentially, the placenta isn't getting enough blood flow.
which is obviously a problem.
Which is a problem, yes. And there's also something called endothelial cell dysfunction involved.
Endothelial cell dysfunction.
It's a mouthful, but basically it means that the cells lining the blood vessels aren't functioning properly.
So the blood vessels themselves aren't working right. What does that even mean? And what happens because of that?
So it's a little complicated, but basically in preeclampsia, the cells that line your blood vessels, they get damaged and inflamed.
Right.
And this makes it harder for blood to flow smoothly, leading to that increased blood pressure. And that increased pressure can impact various organs, including the kidneys, liver, and even the brain.
It's funny, when I was reading through these materials, I actually came across something about placental itching being a potential early sign of preeclampsia. Is that a thing?
That's a great catch, yeah. Um, while not everyone experiences it, some women do report kind of like an unusual itching sensation in their abdomen, especially around the area where the placenta is.
Huh, placental itching.
Yeah, it's not totally clear why this happens, but it could be related to those placental perfusion issues we were talking about.
So that's something to pay attention to, maybe ask your doctor about.
Yeah, for sure.
You also mentioned that preeclampsia can lead to some really serious complications, even something called HELLP syndrome.
Yes.
Can you break that down? What is that?
Yeah, so HELP syndrome is basically like preeclampsia's more menacing older sibling.
Okay.
It's a particularly severe form, and the acronym stands for hemolysis, elevated liver enzymes, and low platelets.
Hemolysis, elevated liver enzymes, and low platelets.
Exactly, let me break it down. Hemolysis means that your red blood cells are being destroyed faster than your body can replace them. Elevated liver enzymes indicate that your liver is stressed and not functioning as well as it should. And then low platelets mean that your blood's ability to clot is compromised.
So blood cell destruction, liver dysfunction, and blood clotting issues, that sounds bad.
It is. It's not good.
So why do these specific problems occur with HELLP syndrome?
Well, remember how we talked about those damaged blood vessels in preeclampsia?
Yeah.
Well, in HELP syndrome, that damage actually becomes so severe that it starts to affect other organs, including the liver. The liver gets inflamed and struggles to function properly, leading to those elevated liver enzymes. And as for the low platelets, it's thought that the damaged blood vessels can actually trap and destroy platelets, which leads to a shortage in the blood.
Oh, wow. So it's this cascade of problems.
Yeah.
Okay, so what are the risks? This all sounds really scary.
You're right to be concerned. HELP syndrome drastically increases the chances of some serious complications, like pulmonary edema,
Pulmonary edema.
where fluid builds up in your lungs.
Oh, gosh.
Yeah, there's also the risk of renal failure, meaning your kidneys stop working.
Oh, my gosh.
And then there's the possibility of liver hemorrhage or even liver failure, and something called disseminated intravascular coagulation.
What?
It's often shortened to DIC, where your blood clotting system just goes haywire.
Oh, wow.
Yeah, and that's not even mentioning placental abruption, where the placenta detaches from the uterus.
Yeah.
The list, unfortunately, goes on.
So those are all potentially life-threatening for both the mom and the baby.
You're right. HELP syndrome and severe preeclampsia in general can actually lead to stroke, acute respiratory distress syndrome, sepsis. It can even be fatal for both mom and baby. So early detection and treatment are critical.
That is terrifying.
Yeah.
Okay, let's shift gears and talk about what can be done. How is preeclampsia identified? How can it be managed to hopefully prevent some of these really bad complications?
Well, first and foremost, it's really important to attend all of your prenatal appointments.
Right.
So your healthcare provider can really keep a close eye on your blood pressure and overall health. In terms of specific signs to look out for, there's obviously high blood pressure, but swelling, especially in the hands and face, sudden weight gain, persistent headaches, vision changes like seeing spots or blurry vision, upper abdominal pain can all be red flags.
Right, those all sound like warning signs for sure. What about lab tests? I always thought that they check for protein in the urine for preeclampsia.
You'd think so, right?
Yeah.
But here's the thing. While proteinuria, that's the medical term for protein in the urine,
Okay.
it is commonly associated with preeclampsia. It's not actually a foolproof diagnostic test. There are other reasons why a pregnant woman might have protein in her urine, and some women with preeclampsia don't actually have proteinuria at all.
So how do they diagnose it then if the urine test isn't completely reliable?
It's really a combination of things, you know. Elevated blood pressure is definitely the main indicator, along with those other symptoms we talked about, and just the overall clinical picture. And here's a detail you might find interesting. The source material actually emphasizes the importance of manual blood pressure measurements over electronic ones.
Wait, really? I would thought electronic would be more accurate. What makes the manual readings better in this case?
It seems counterintuitive, right?
Yeah.
But electronic blood pressure cuffs can sometimes be thrown off by all the changes in blood flow and vascular resistance that are happening during pregnancy.
Oh, okay.
Manual readings, when they're done correctly, they're considered the gold standard for accuracy.
Wow. Okay, good to know.
Yeah.
So once preeclampsia is diagnosed, then what happens?
Well, the approach really depends on how severe the preeclampsia is. For milder cases, the focus is usually on close monitoring.
Okay.
So this means frequent prenatal checkups to track blood pressure, urine protein levels, and fetal growth. And they might also recommend some lifestyle modifications like restricting activity, maybe dietary changes like reducing salt intake, and sometimes medications to help lower blood pressure.
So close monitoring and lifestyle changes for milder cases. But what if it's more severe? What if there are signs of those complications that we talked about?
Right. In those situations, more aggressive management is needed. It might mean hospitalization for closer observation and more intensive treatment. And they'll definitely bring in a specialist called a perinatologist.
A perinatologist.
Yeah, who specializes in high-risk pregnancies. They'll likely use IV medications to control blood pressure and prevent seizures. And in some cases, they might even recommend delivering the baby early, especially if the baby is mature enough or if the mother's health is really at risk.
So even though it's a pregnancy condition, sometimes the best course of action is actually to end the pregnancy
Yeah,
to protect everybody. That's a tough decision.
it is a tough decision. It's a constant balancing act between prolonging the pregnancy to give the baby more time to develop and intervening to protect the health of both mom and baby when things get too dangerous.
You mentioned medications to prevent seizures. Is that where magnesium sulfate comes in? I read that's used in preeclampsia. What does it do?
Yes, magnesium sulfate is a really powerful anticonvulsant, which means it prevents seizures.
Yeah.
And it's often given intravenously to women with severe preeclampsia or eclampsia to protect them from seizures, which can be life-threatening.
It's like a safety net.
Exactly.
What about after the baby is born? Does preeclampsia just go away?
It usually improves pretty rapidly after delivery because the placenta, which is thought to be the main driver of preeclampsia, is no longer there.
Right.
However, women who have had preeclampsia are at a higher risk for developing cardiovascular problems later in life, so ongoing monitoring is really important.
Oh, so even though it resolves after delivery, there can be long-term impacts.
Exactly.
Okay, something to keep in mind. So we've talked about preeclampsia and eclampsia. Now let's talk about chronic hypertension during pregnancy.
Huh.
What are the specific risks when a woman already has high blood pressure going into the pregnancy?
So, chronic hypertension during pregnancy definitely adds another layer of complexity and risk.
Okay.
It increases the chance of several complications, including placental abruption, which we discussed before. So remember, that's when the placenta detaches prematurely and cuts off the baby's oxygen supply. There's also a higher risk of developing superimposed preeclampsia on top of the chronic hypertension, which is not good. And unfortunately, there's an increased risk of perinatal mortality.
Perinatal mortality, what does that mean?
So perinatal mortality refers to the death of a baby either during pregnancy or shortly after birth.
Oh, wow.
It's obviously a heartbreaking outcome, and it's more common in pregnancies that are complicated by chronic hypertension.
That is incredibly sad.
Yeah.
What about the baby's development during pregnancy? Are there specific risks to the fetus when the mother has chronic hypertension?
Yes, definitely. So remember, chronic hypertension restricts blood flow,
Right.
and that includes blood flow to the placenta, which can impact the baby's growth and development. This can lead to something called fetal growth restriction, where the baby is smaller than expected for its gestational age.
Okay.
And then preterm birth is another risk, meaning the baby is born prematurely, often before their organs are fully developed.
So chronic hypertension can just create a cascade of problems. I know medications are often used to manage high blood pressure. Are there any special considerations when it comes to medications for pregnant women?
Absolutely. Not all blood pressure meds are safe during pregnancy
Huh.
because some can cross the placenta and potentially harm the developing baby.
Right.
So doctors really have to carefully select medications that are known to be safe for both the mother and the fetus.
What about breastfeeding? Does chronic hypertension, or I guess the medications used to treat it, impact breastfeeding at all?
Yeah, that's another important thing to consider. Some blood pressure medications can pass into breast milk and could potentially affect the baby.
Gotcha.
But the good news is that there are some safe options available for breastfeeding mothers.
Oh,
L-dopa and hydralazine are two that are often used for women with hypertension who want to breastfeed.
so talking to your doctor is important.
Oh, absolutely. Open communication about medication choices is really crucial if you're breastfeeding. They can help you find the best option that's safe for both you and your baby.
Yeah, it sounds like it's really a team effort to manage this safely and effectively. Well, this has been a really eye-opening dive into hypertension during pregnancy. I'm already feeling so much more informed, but we've only scratched the surface.
Yeah, just the tip of the iceberg?
There are so many other gestational conditions to explore.
There are.
Are you ready to keep diving in?
Let's do it. I'm ready when you are.
Great, we'll be right back after this quick break. Okay, we're back and ready to tackle some more of these gestational conditions. Hypertension is obviously a big one, but there are others out there that can pop up during pregnancy, some that I'm honestly not too familiar with.
Right, and they can be just as serious.
Yeah.
One we should definitely talk about is hyperemesis gravidarum.
Hyperemesis gravidarum, that's a mouthful.
It is, and it's a much more serious condition than the name might suggest. A lot of people are familiar with morning sickness.
Right, which is really common.
Yeah, but hyperemesis gravidarum is like morning sickness on steroids.
And we're talking excessive vomiting that leads to dehydration, electrolyte imbalances, significant weight loss. It can be so debilitating that women need to be hospitalized for IV fluids and medications.
Wow, so it's not just a little nausea. It sounds really tough to deal with.
Is
What causes hyperemesis gravidarum? Is it just like a more extreme form of morning sickness, or is there something else going on?
That's a good question. It's one that researchers are still trying to fully answer, but it's thought to be related to hormonal changes during pregnancy,
Okay.
particularly the rapid increase in HCG levels. Some theories suggest that certain women might just be more sensitive to these hormonal fluctuations,
Okay.
which leads to the more severe symptoms of hyperemesis gravidarum.
So it's like the bodies are overreacting to the pregnancy hormones.
Yeah, you could say that.
And you mentioned it can be serious if it's not managed.
Absolutely. Severe dehydration and electrolyte imbalances can actually be life-threatening for both the mother and the fetus. It's not something to mess around with. So if you're experiencing a lot of vomiting during pregnancy, definitely seek medical attention.
Yes, early intervention is key to preventing those complications.
All right, so we've covered hyperemesis gravidarum. What other gestational conditions should we be aware of?
Let's talk about hemorrhagic disorders, which are basically conditions that involve bleeding.
Oh, bleeding during pregnancy. That sounds scary. Is it always a sign of something serious?
So, while some bleeding, especially spotting, can be normal in early pregnancy, any bleeding during pregnancy should always be checked out by a healthcare provider
Okay.
to rule out any potential problems. Hemorrhagic disorders during pregnancy are considered medical emergencies
Okay.
because they can be really risky for both the mom and the baby.
Okay. That makes sense. Better safe than sorry. What are the dangers of bleeding during pregnancy? What makes it so risky?
So, for the mother, the most immediate concern is blood loss,
Right.
which can lead to something called hypovolemia,
Hypovolemia.
which means a decrease in blood volume. This can cause a drop in blood pressure, weakness, dizziness, and in severe cases, even shock.
So the blood loss itself is a major problem. Are there other risks too? You mentioned anemia.
Right, so anemia is another risk associated with blood loss. It basically means the blood doesn't have enough red blood cells to carry oxygen effectively.
Okay.
This can make the mother feel tired and weak, and it can also affect the baby's development by reducing the oxygen supply to the placenta. And then, of course, there are the general risks associated with any kind of bleeding, like infection.
So blood loss, anemia, infection, those are serious risks for the mother. What about for the baby? How does bleeding impact the fetus?
So bleeding during pregnancy can deprive the baby of oxygen and essential nutrients, like we were talking about with anemia.
Right.
It can also increase the risk of preterm labor, which is when labor begins before 37 weeks of pregnancy.
Preterm labor, that's when the baby is born too early, right? What are the risks with that?
Exactly. Premature babies often face a lot of challenges. Their organs might not be fully developed, which can lead to breathing problems, feeding difficulties, and other complications.
Gotcha.
They're also more susceptible to infections, and they may have to stay in the NICU for a while.
So it sounds like these hemorrhagic disorders during pregnancy are incredibly complex and can be devastating for both mom and baby.
They can be, and because there are so many different conditions that can cause bleeding during pregnancy,
Why?
a thorough evaluation is always necessary to determine the cause and the best treatment.
Okay, so let's talk about some of those specific conditions. I know miscarriage is one that a lot of women unfortunately experience. Can you tell me more about that?
Sure, so miscarriage, which is also called spontaneous abortion, is sadly quite common. It's basically defined as the loss of a pregnancy before 20 weeks of gestation.
Are there different types of miscarriages, or is it all kind of the same?
There are different types. The most common type is a complete miscarriage, where all of the products of conception, the tissue from the pregnancy, are expelled from the uterus. Then you've got incomplete miscarriage, where some of that tissue remains in the uterus. There's also missed miscarriage, which is when the embryo or fetus has stopped developing, but it hasn't been expelled from the uterus.
Oh, wow.
And then threatened miscarriage is when there's bleeding, but the cervix remains closed and the pregnancy might continue.
Wow, so many different scenarios, and I imagine they all come with their own challenges
Yeah.
and emotional impacts. What are the typical signs of a miscarriage?
The most common sign is vaginal bleeding, which can range from light spotting to heavy bleeding.
Okay.
There might also be cramping or pain in the abdomen or lower back. However, it's important to remember that some bleeding in early pregnancy is normal, so any bleeding should be reported to a healthcare provider.
So even if it's just spotting, it's worth checking with your doctor.
Definitely.
How is a miscarriage managed?
It really depends on the type of miscarriage and the individual circumstances.
Good.
Sometimes the body will naturally expel the pregnancy tissue on its own, which is called expectant management.
Expectant management.
Other times, a procedure called a dilation and curettage, or DNC, is necessary to remove any remaining tissue.
PNC.
Yeah, and medications can also be used to help the uterus contract and expel the tissue.
So there are different approaches, and in addition to the medical management, I think it's really important to acknowledge the emotional impact of a miscarriage.
For sure.
Losing a pregnancy, no matter how early it happens, can be so difficult.
Absolutely. Emotional support is a crucial part of miscarriage care.
Yeah.
Losing a pregnancy is a significant loss, and women really need time to grieve and heal.
Definitely. It's not just a physical event.
It's not.
It's an emotional one. So we've talked about miscarriage, which is a loss of pregnancy before 20 weeks. Are there any other conditions that affect early pregnancy?
Yes. One is reduced cervical competence, sometimes called an incompetent cervix.
Incompetent cervix. That sounds kind of harsh. Is that really the medical term?
I know the terminology is a bit outdated and it can feel insensitive, but what it refers to is a condition where the cervix starts to open or dilate prematurely during pregnancy, usually in the second trimester.
Okay.
And this can lead to miscarriage or preterm birth.
So the cervix basically isn't strong enough to hold a pregnancy.
Right.
What causes that?
The exact cause isn't always clear, but it can be related to previous cervical trauma, like a surgery or a difficult delivery.
Okay.
It can also be congenital, meaning someone's born with a weaker cervix.
So it can be acquired or something you're born with.
Right.
What could be done to manage it?
So one common treatment is a procedure called a cervical cerclage.
Cerclage. That sounds familiar.
Yeah, it basically involves stitching the cervix closed to help prevent it from opening too early.
Can you remind me how that works?
Of course. It's a pretty straightforward procedure. The cerclage is usually placed in the second trimester, and then it's removed later in the pregnancy, typically around 36 or 37 weeks when the baby is full term.
So it's a temporary reinforcement for the cervix.
Exactly. It helps support the cervix and hopefully prevent preterm labor or miscarriage.
Okay, that makes sense. Another condition I've heard of that can occur in early pregnancy is an ectopic pregnancy.
Yes.
Can you explain what that is?
Sure. In an ectopic pregnancy, the fertilized egg implants somewhere other than the lining of the uterus.
Okay.
The most common location is the fallopian tube, but it can also happen in the ovary, the cervix, or even the abdominal cavity.
So the egg is basically in the wrong place.
Yeah, it gets lost.
Why does that happen? Can you prevent it?
So the exact causes of ectopic pregnancy aren't always clear, but there are things that can increase the risk.
Okay.
Things like a history of pelvic inflammatory disease, previous ectopic pregnancy, smoking, and some fertility treatments.
Gotcha.
Unfortunately, there's no guaranteed way to prevent ectopic pregnancy,
Okay.
but being aware of the risk factors and getting medical attention if you have any unusual symptoms early in pregnancy can help.
So early detection is key.
Absolutely.
And you mentioned that ectopic pregnancies can't continue to develop normally.
Right.
What happens if it's not treated?
If it's left untreated, it can rupture the fallopian tube or other affected organ and cause internal bleeding, which can lead to life-threatening complications.
So how is it diagnosed and treated?
The main tools for diagnosing it are blood tests and ultrasound.
Okay.
They'll check the levels of human chorionic gonadotropin, or HCG,
HCG.
which is a hormone produced during pregnancy. In an ectopic pregnancy, those HCG levels might not rise as quickly as they should in a normal pregnancy.
Right.
And then a transvaginal ultrasound, which is basically an ultrasound where they use a probe inserted into the vagina,
Right.
can help visualize the pregnancy and confirm its location.
So they can see if it's implanted in the right place.
Exactly.
What are the treatment options?
It depends on the location of the ectopic pregnancy, the woman's overall health, and how far along the pregnancy is.
Oh.
Sometimes medication can be used to dissolve the pregnancy tissue. Methotrexate is one that's commonly used.
Methotrexate.
Yeah. In other cases, surgery is needed to remove the ectopic pregnancy. This is often done laparoscopically, using tiny incisions and a little camera to guide the procedure.
So there are both medical and surgical options.
Yeah.
And it sounds like Getting diagnosed early is really crucial.
Absolutely. Early diagnosis and treatment are really important in ectopic pregnancy to prevent those complications we were talking about.
And this is definitely heavy stuff,
Yeah, it is.
but it's really important information.
It is.
So we've been focusing on these early pregnancy conditions, but there are also things that can pop up later in pregnancy, right? Like in the third trimester.
Oh, absolutely, for sure.
Okay, so let's talk about those. What kind of things can come up in the third trimester?
Let's talk about late pregnancy bleeding. There are two main conditions that fall under this category: placenta previa and placental abruption.
Placenta previa and placental abruption, they both sound serious.
They're distinct conditions, but both can be life-threatening for both the mother and the baby. Let's start with placenta previa.
Okay, tell me about placenta previa.
Okay, so in placenta previa, the placenta, which is the organ that nourishes the baby,
Right.
is implanted in the lower part of the uterus, and it's either partially or completely covering the cervix.
The cervix, that's the opening of the uterus, right?
Oh,
So the
yeah.
placenta is blocking the exit.
Pretty much, yeah. And that's a big problem because as the cervix starts to thin and dilate, in preparation for labor,
Right.
the placenta can tear, causing bleeding.
Oh, wow.
And this bleeding can be painless, which is kind of weird.
Painless, so you might not even know anything's wrong.
Exactly. That's why it's so important for women to report any bleeding during pregnancy to their doctor, even if it doesn't hurt.
Okay.
Sometimes there might be mild cramping or a feeling of pressure in the pelvis, but often the bleeding is the first and only sign.
So any bleeding in the third trimester is cause for concern?
Pretty much.
How is it diagnosed?
The main way to diagnose placenta previa is with an ultrasound.
Okay.
It's a safe and painless way to see the placenta and where it's located in relation to the cervix.
So they can see if it's blocking the cervix.
Yes.
What are the treatment options?
So the management of placenta previa depends on the severity and whether the woman is bleeding.
Okay.
If the placenta is only partially covering the cervix and there's no bleeding, the doctor might just recommend watchful waiting, which involves close monitoring with ultrasounds and prenatal checkups. They might advise limiting activity and pelvic rest, which means avoiding anything that can put pressure on the cervix, like sex or strenuous activity.
So it's a wait-and-see approach,
Mm-hmm.
but with careful monitoring. But what if the placenta is completely covering the cervix, or if there is active bleeding?
In those situations, a cesarean section is usually the safest way to deliver the baby.
A C-section.
Yeah, vaginal delivery is not recommended with placenta previa because of that high risk of bleeding during labor.
Right, because as the cervix opens, the placenta could tear.
Exactly, and that could be life-threatening for both the mother and the baby. A C-section lets them deliver the baby without messing with the placenta.
So it bypasses that risk.
Ex-
You mentioned earlier that cases of placenta previa are on the rise.
Yes.
Is there something that's causing that increase?
That's a good question, and it shows how interconnected these different conditions and medical interventions are.
Right.
The textbook we're looking at actually says that rising C-section rates are a possible contributing factor to this increase in placenta previa.
Wait, so you're saying that C-sections might actually be leading to more cases of placenta previa?
Yeah, it seems counterintuitive.
Yeah.
But that's what the research is suggesting. So when a woman has a C-section, there's a scar on the uterus.
Right.
And the scar tissue can interfere with placental implantation in later pregnancies, making it more likely that the placenta will attach lower in the uterus, near or over the cervix.
Wow, so the C-section could have unintended consequences down the line.
Exactly. It really shows how medical interventions, can sometimes have these unintended consequences. It makes you think about the long-term impacts.
Yeah, definitely makes you think.
It's a complicated issue.
Yeah.
It emphasizes how important it is to carefully consider the risks and benefits of any procedure
Right.
and to go for the least invasive approach whenever possible.
It's about finding that balance, managing the immediate risks, but also being mindful of potential long-term consequences.
Right.
Okay, so we've covered placenta previa, which is when the placenta blocks the cervix. The other late pregnancy bleeding condition you mentioned was placental abruption. What's that one about? What makes it different from placenta previa?
Okay, so placental abruption, also called abruptio placentae, is when the placenta detaches prematurely from the uterine wall.
Oh, wow.
This can actually happen anytime after 20 weeks of pregnancy, but it's most common in the third trimester.
And that sounds like it would cut off the baby's oxygen supply, right?
Exactly, and that's what makes it so dangerous. The severity depends on how much of the placenta detaches and how quickly it happens.
Okay.
In mild cases, there might be some bleeding and discomfort, but the baby's oxygen supply might not be affected too much.
Yeah.
But in severe cases, a large part of the placenta detaches, and that causes heavy bleeding and can really compromise the baby's oxygen and nutrient supply.
So what are the signs and symptoms?
Unlike placenta previa, which often involves painless bleeding,
Right.
placental abruption is usually pretty painful.
Oh, yeah.
Women describe it as a sudden, sharp, stabbing pain in their abdomen. There might also be back pain and vaginal bleeding.
So the pain is a key difference between placenta previa and placental abruption.
That's right, but not all cases of placental abruption involve visible bleeding.
Really?
Yeah, sometimes the bleeding is hidden within the uterus.
So even without bleeding, if you have really bad abdominal pain during pregnancy, that's a warning sign.
For sure, always better to err on a side of caution and get checked out by a doctor
Right.
if you're having any unusual pain during pregnancy.
Let's talk about how placental abruption is managed. Is it similar to placenta previa?
Like with placenta previa, managing placental abruption depends on how severe it is and how far along the pregnancy is. If the abruption is mild and the baby's doing okay, the doctor might recommend just close monitoring in the hospital.
Okay.
This could involve bed rest, fetal monitoring to check the baby's heartbeat, and regular ultrasounds.
So they're keeping a close eye on things.
Exactly.
But what if the abruption is more severe or the baby's in distress?
Then an emergency C-section is usually necessary to deliver the baby as quickly and safely as possible.
So again, sometimes the safest option is to deliver early.
It is. The goal is to balance the risks and prioritize the health of both the mother and baby.
You also mentioned earlier that there are different classifications of placental abruption.
Yes.
What does that mean?
So it's often graded based on severity.
Okay.
Grade 1 is a mild abruption with very little bleeding, and the baby's doing fine. Grade 2 is moderate with more bleeding, and there might be signs of fetal distress. And grade 3 is severe, heavy bleeding, the baby's in distress, and often the mother is having complications like shock or blood clotting problems.
So the higher the grade, the more urgent the situation.
Exactly. Grade 3 abruptions are emergencies that need immediate medical attention.
This is all incredibly serious stuff.
It is.
It makes you realize how important it is to have a good healthcare team
Absolutely.
who you trust.
Pregnancy is a remarkable process, but it's not without risks.
Yeah.
Understanding these complications can help women advocate for their own health and the health of their babies.
We've covered so much today, it's clear that gestational conditions can be really complex and challenging.
Yeah.
Before we wrap things up, I wanted to go back to something you said earlier about the rising rate of placenta previa being linked to C-sections.
Right, that's an important point. While medical interventions like C-sections can be life-saving in certain situations,
Yeah.
it's really crucial to be aware of the potential downstream effects.
So it's a balancing act.
It is.
Women need to be informed.
Yes, absolutely. They need to know the risks and benefits so they can make choices that are right for them and their families.
Well said. Knowledge is power, and understanding these gestational conditions can help women be proactive in their prenatal care and make good decisions about their health.
I couldn't agree more. Communication with healthcare providers, asking questions, and seeking second opinions if you need to are all important parts of managing the complexities of pregnancy, especially when there are high-risk conditions involved.
Absolutely. Well, this has been an amazing dive into gestational conditions.
It has.
We've covered so much, from hypertension to hyperemesis gravidarum to hemorrhagic disorders.
A lot of ground.
It's a lot, but I think it's crucial information for anyone who is pregnant or thinking about becoming pregnant.
Definitely.
You never know what you might face.
That's true.
Being informed is the best way to prepare.
It is. I agree. Knowledge is empowering, and I hope this has given our listener a better understanding of the potential complications that can arise and the importance of communication with their doctor.
And on that note, we'll conclude our deep dive into high-risk pregnancy conditions. Thanks for joining us on this journey of knowledge and discovery. We'll see you next time for another fascinating deep dive into a topic that matters to you. We've covered so much ground in this deep dive into these high-risk pregnancy conditions. From hypertension to bleeding disorders, it's clear that pregnancy can be a wild ride.
It can be, but even with all those challenges, it's good to remember that most pregnancies actually have positive outcomes.
That's true.
Knowledge and awareness are key.
Absolutely. Speaking of knowledge, before we wrap up, I wanted to circle back to something we discussed earlier. You mentioned that expectant management is sometimes an option for both placenta previa and placental abruption. Can you remind me what that means and why it's not always the best choice?
Yeah, so expectant management basically means taking a wait and see approach.
Right.
You're closely monitoring the situation without doing anything right away. It's often considered when the condition is mild, the pregnancy's still early, and both the mother and the baby are stable.
So you're just kind of watching and hoping things resolve on their own.
Yeah, kind of like hitting the pause button.
Right.
But it's not always safe. If there's a lot of bleeding, or the baby's showing signs of distress, or the pregnancy is further along, then expectant management is just too risky. In those cases, more active intervention, like a C-section, is needed to protect everyone.
It's such a delicate balance,
It is.
trying to decide when to wait and see and when to intervene.
Right, and those decisions are made with a whole team of healthcare professionals.
Right, of course.
Obstetricians, perinatologists, nurses, and sometimes other specialists. It's a group effort to make sure things are as safe as possible for both the mom and the baby.
You've given us so much to think about today, and it really highlights how important it is to have a supportive healthcare team that you trust.
Absolutely.
Any final thoughts for our listener before we go?
I would just stress the importance of open and honest communication with your healthcare providers throughout your pregnancy. Don't be afraid to ask questions or voice any concerns you might have. You have a voice, and your healthcare team is there to support you.
That's such great advice. It's easy to feel overwhelmed during pregnancy,
Yeah.
but having a team you can rely on and feeling confident in your decisions
Yeah.
makes such a difference.
Exactly. Feeling informed and confident can make the whole experience a little bit easier.
And on that note, I think we've reached the end of our deep dive into these high-risk pregnancy conditions. Thanks for joining us, and we'll see you next time for another deep dive.